if you have a neck patient, ask the patient to do the neck movements. That's the easiest part. Okay, so the first is flexion. What do you feel? Nothing?
Yeah.
Nothing.
So all the extensors are stretched now, all the extensors. He doesn't feel nothing, so not a big problem on the extensor muscles. Okay, if you do extension, very good range. What do you feel?
He feel like uncomfortable.
Where?
Where?
Left.
Left
That
side,
up,
yeah.
like here. Okay, now he has some problem in extension, initially extensor muscles, yeah? What can be also when you have problem in extension and pain? What's the first possibility? So flexion is good, extension has a little bit of annoyance.
Joint problem.
Yeah, it can be because normally trigger points are not painful in contraction that much. So yes, you can do it passively to see if there is a different pain.
A little bit pain.
But I don't like this, to do it passively, because it's a very bad movement for the neck. But in general, even if you have trigger points, they are normally have some pain with stretching, not extension. So it doesn't make sense to be
보통
the primary thinking. But let's say the first possibility is to be a facet joint, not a disc, a facet joint. Good. If you go to the side.
facet joint. Side bending.
No, this side. What do you feel? Good range, very good.
Okay.
And on the other, so muscles on the side, good.
Good.
No pain?
Yeah.
That's a little bit strange now, because if it's a facet joint on the left, has pain with extension, he must have some pain on side. This is a closing pattern, and this is again a closing pattern. Pain?
No.
No. So it's strange, you know. It's very small. When something is very small, it's much more difficult to find. When something is big, you find it very quickly. And normally he will not ask for treatment at this stage. Nobody goes to pay money to resolve this problem. So it's difficult to find because nobody is asking for that. Good. Rotation.
괜찮은데?
Nothing?
He getting better.
Eh?
He getting better.
So you need some more movement. You must move more. So he's good, no restriction, he has a little bit of pain in extension, and that's it, nothing more. It can be a little bit of a facet problem on the left or a little bit of dysfunction, facial dysfunction on the left, something very small. But let's say we have this and we like to search it, okay? So the first thing, it's that you can palpate the trapezius. What do you feel here? Oh. Do we have a pillow? When I have a person with a unilateral neck problem, I don't spend my first treatment in prone. I usually go to side lying, which is much safer.
자,
Because if you have a real neck patient, you bring him. Can we have a little bit more thicker pillow? If you don't know the patient and ask the patient to be 10 minutes in prone and you're pressing, you know, it can be worse afterwards. So instead of helping, you make him worse. So the most safe approach is, so we show trapezius from sitting, from prone. Now I will check from side lying, is to go side lying. So it's the first muscle to address. It's the more superficial in the group. And here I'm going more to the more central part,
자,
based
이렇게
on his
해가지고
symptom,
보다
not to the lateral part, the more proximal part. He must communicate with me. What does he feel? What do you feel?
he get worse. He got the pain.
His pain?
Yeah.
So big possibility his minor dysfunction to be on trapezius. How do I know that? I will search. I will treat. Pain? Here? I'm trying to find the worst point for him. It's
지금
more
가장 안
towards
좋은
the
부분.
skull or towards the shoulder. This is the worst? Good. Now, I have options. Either to stay here for a technique 1, or to do a technique 2A,
Technique
or
2A.
to do a technique 2B. So I will stay stable
2B
and I will
합니다.
move the head instead of moving my hands. So you have always the possibility, instead of moving your hand, to move the body part. Can you go sitting again? And do again the flexion
그렇게
extension.
extension 해보세요.
아픈데 좀.
More pain now.
예.
Yeah?
More pain now.
More pain?
Similar. He got the similar pain.
The same, like
Yeah,
before,
yeah.
not changed. Come again.
Change.
So,
좋아질
maybe
때까지
it's
한다.
not trapezius. I must search
그래서
deeper.
트라페지우스는
Yeah?
안 갔어요 일단. 트라페지우스 했는데.
So let's search deeper. The next muscle I like to go,
deeper하게 갑니다.
it's splenius. So you can also write, so splenius is the muscle which is exactly below trapezius. Come from this side. So trapezius, it's more medially and it's the
Trapezius,
most superficial, like this. Splenius is below trapezius and goes to the mastoid process. It's here, it's below the ear. So it goes like this.
So I
If
see.
you like to find splenius, you will notice that after trapezius, the neck has a gap and then goes up again. You feel a gap in the side of trapezius. If you go to this gap and ask for a full rotation ipsilaterally, you feel something
뭔가
hitting your
느껴지는
hand, like splenius capitis.
이게
So you don't
capitis.
have a gap anymore. If you, in yourself, if you find this gap after trapezius,
여러분,
you feel that it's not gap because the
rotation
muscle
할
is
때
pumping out.
예, 갭이 없어지면서 여러분 손을 이렇게 탁 치는 느낌이 들 겁니다.
Now, the fiber direction, is it okay to write with a... Yeah, but so this is the fiber direction
Fiber
as it
direction.
goes to the mastoid process. The mastoid process is here. So from the spine, the muscle fibers go to the spinous, to the mastoid process. Now, we have a clear gapfold palpation. So if you take the trapezius here, that's one muscle, it's over splenius. The other muscle is sternocleido here. Between trapezius and sternocleido, this is splenius just below the skin. So this is a clear triangle for palpation. So again, if you find the trapezius
trapezius
before,
잡거든요.
and if you take the sternocleido, the gap
sternocleido 잡고,
between trapezius and
LCM 잡고.
sternocleido, it's you have splenius. Look, this is the muscle below the skin. Go over. If you go perpendicular, you will feel the muscle pumping out. Now, here we have a problem that sometimes as we press for the muscle, we are pressing the vertebra to the ground. So normally,
수직으로 이렇게
I'm
누르면
holding with the one hand stabilize the vertebra and with the other I'm palpating. What do you feel?
he got the pain.
It's your pain, it's like the one in extension or a new one? Doesn't know.
He doesn't know.
Good.
He doesn't know.
It happens.
He-
Now, the next question, I'm here. I like you to compare this to this. What is more painful for you?
이거 원래 있던 것 같아요.
It's more pain.
So this is less painful.
This point is
오.
he got the pain.
More up.
He already got the pain.
Here, it's more.
familiar pain.
So the trigger point is closer to the mastoid than to the origin from the spinous process. So I'm still assessing. If I like to work on this trigger point, I can either stay for a technique 1,
그래서 찾으면
Or
스테이블하게 이제
I
또
can do a
테크닉 1
technique
적용하고
2.
테크닉 2도
A.
적용하고
I'm
To
moving
A.
now. How do you feel?
he's still pain.
Sometimes I'm moving a little bit left or right to the tote band. So instead of going along the fiber, sometimes I'm going over the fiber to be sure that I'm staying over the fiber. So every 1 or 2 times I can go in line with the fiber, I cross the fiber to be sure that I'm in the right place. Sometimes I
때로는
go
이렇게
on
왔다 갔다
working
오른쪽에.
in a transfer fashion, but it's more
트랜스포스로
painful.
하면
So when you are working along, it's a little bit more easy for the patient to accept. This is a little bit more, you are more sure that you are in the taut fiber, it can be a little bit more painful.
그러니까 트랜스포스로 하면 더 좀 아프.
Decide based on the patient. Pain? Now I'm pressing a lot. I have 2 hands on it.
여기 좀 차오르면
Pain?
A little bit pain.
So it's getting less because I'm
자,
pressing
좋아지고
more.
있습니다.
So the sensitivity goes less. So we can test it again.
오.
Give him the money now. Good, better? So, come again, repetition. The first step is, so first assess the movements of the neck, that's one. Second, find trapezius from a new position, which is side lying. Same muscle, different position. Third, you put one hand below and go in front of trapezius, but behind the sternocleido, have a pen, if it's possible, and draw a line between the spinous process and the mastoid process, which is behind the ear. And then go transversely to this line on the gap, because here it's the place that splenius is fully superficial below the skin, and go transversely to this line to find if there are any taut bands. If you have a taut band, try to see if it's more sensitive going towards the spinous process or towards the mastoid process. Stay on the most painful spots and work technique either one or 2A.